Nigeria's confirmed COVID-19 cases rise to 232. Nigerian doctors trade union Congress kick against Chinese doctors' invitation to Nigeria. In international news, U.S. officials warn of hardest week of COVID-19 crisis as death toll worsens. And in sport, Premier League 2019-2020 season suspended indefinitely.
This is ANN News.
The Center for Disease Control, NCDC, has announced an uptick of 8 new COVID-19 cases, bringing the total confirmed cases of the country to 232. As of Sunday, 33 have been discharged, while 5 deaths have been recorded. NCDC said on its official Twitter handle, Lagos has 5 of the new cases. The Federal Capital Territory has 2 and 1 was reported in Kaduna State. The Association of Resident Doctors in Delta State University Teaching Hospital has raised the alarm over inadequate face masks and lack of life insurance or compensatory measures for staff that manage the dreaded COVID-19 disease. The association said in a statement it is unhappy with the management's delay in closing all outpatient clinics in the face of the COVID-19 pandemic. It says this would be a precautionary measure to forestall exposure of multiple medical personnel to the disease. The group says there is a shortage of face masks needed as precautionary protocols against the disease. The resident doctors want Delsuth management to shut down all outpatient clinics until COVID-19 cases have declined in Nigeria. The federal government's decision to bring in an 18-man team of Chinese medical experts is being opposed by Nigerian doctors and the Trade Union Congress leadership. The doctors say the action is embarrassing to the association and other health workers who give their best under deplorable working conditions in the fight against COVID-19 pandemic. Nigerian Medical Association President Francis Faduyile said in a statement on Sunday, the move is a misplaced priority. The association says the invitation is capable of undermining their efforts and expertise as frontline healthcare workers risking their lives to check the spread of the virus in Nigeria. The Trade Union Congress of Nigeria also advised the federal government to invite the Chinese team, as Nigerian doctors are already effectively handling the cases. But the Director General of the National Orientation Agency, Dr. Garba Abari, says the Chinese medical team were only coming to share experiences with the Nigeria Center for Disease Control, not to directly take charge of the fight against COVID-19 pandemic in the country. Academic Staff Union of Polytechnics has suspended its planned indefinite strike, which was to have started today, Monday. The union's 2-week notice expired on Friday. ASUP's President Anderson Ezeibe said in a statement the lecturer's decision to suspend the strike was because of the current COVID-19 emergency. ASUP says the intended strike was in protest against the government's inability to honor an agreement the two parties reached 10 years ago. Oyo State Governor Seyi Makinde has tested negative to coronavirus. The governor revealed this on his Twitter handle late Sunday night. The governor had tested positive for coronavirus a week ago, a few days after his party PDP staged a rally in his state. Makinde says this is a second test revealing he's negative. Major General Farouk Yahya has taken over as the new theater commander of Operation Lafia Dole in Maiduguri, Borno State capital. Yahya took over from Major General Olusegun Adeniyi, who was redeployed to the Nigerian Army Resource Center as senior research fellow. In a brief ceremony at the Military Control and Command Headquarters, Yahya was presented with a command flag by his predecessor after signing the handover and takeover notes. In his remark, the new commander asked for cooperation of all the components in the theater to enable him to succeed in the ongoing operations against insurgency in the northeast.
Coming up, African stories. Ethiopian government to pump $450 million into economy to soften COVID-19 impact. And later, international news. U.S. facing hardest COVID-19 week as it faces mounting death toll.
You are watching ANN.
Correct, Costi. Give me 100 naira rice and add 888 join up. On top. Yes.
Which time I go be this now? Not be the same 100 when everybody they pay this morning.
They no use code.
Which code?
Oh boy, no get it for market to get better wolf. 888 now be the code yo. Have you?
Madam, I beg, serve me 888.
Welcome back. This is ANN News. South Sudan has confirmed its first case of COVID-19, becoming the latest African nation to report a case of the disease. Officials say the patient is a 29-year-old female working for the United Nations who recently arrived in the country from the Netherlands. Vice President Riek Machar said on Sunday that the patient was being treated in isolation. Meanwhile, experts have warned that the consequences could be dire if the virus spreads rapidly in South Sudan, which has extremely limited health facilities. More than 1 million persons are still displaced from their homes, following a 6-year civil war that killed at least 400,000 persons. Ministers were finally appointed last month after the former rebel leader Riek Machar and President Salva Kiir signed a peace deal to form a unity government. After going through its own horrendous coronavirus experience in which nearly 4,000 Chinese people died, the country is now sharing its experience with other countries to help in the fight against the disease. Mozambican health workers are in Sichuan district in China to garner some of that experience. Mong Christian has the details.
At the request of the Mozambican government, medical experts at West China Hospital of Sichuan University have shared the experience of combating COVID-19 with their counterparts at Maputo Central Hospital. The 2-hour training program included the diagnosis and treatment, as well as the management of medical staff and patients.
China has taken very strong measures in the prevention and control of this epidemic, which helped curb its development quickly. Mozambique wants us to organize this remote training to pass on medical knowledge to their staff and to better respond to the outbreak.
Mozambique has declared a state of emergency after 10 infections were confirmed on April 1st.
The training is an opportunity for our medical staff to learn about China's advanced experience and measures for coronavirus prevention and control. We have mobilized all our medical staff to respond to the outbreak.
According to China's National Health Commission, there are around 1,000 Chinese medical experts working in Africa, providing medical support and treating local patients. Since the COVID-19 outbreak, they have trained over 10,000 local medical staff.
They have brought to us skills about surgery, urology, traditional Chinese medicine, anesthesia, obstetrics, and gynecology. The patients treated by the Chinese medical team highly appreciate their medical expertise. They have helped improve Mozambique's medical capabilities.
The management of West China Hospital says the experience is based on their clinical trials and practices.
We have not only focused on COVID-19 prevention and treatment here at the hospital, but have also reached out to others. We have sent out our medical experts to other parts of China and to countries around the world.
At the training session, the two sides discussed the biosafety of operating rooms, managing isolation areas, and protecting medical staff at intensive care units, among other topics. And to help the continent win the battle against COVID-19, more training programs are scheduled to take place in the coming days.
The Ethiopian government is injecting more than $450 million as liquidity for private banks to cushion the economy for the impact of the coronavirus as the first death linked to the disease is recorded. Reporter Gidon Chala has the details.
Like most in the world, the Ethiopian economy is feeling the hit caused by the coronavirus pandemic. The government has diverted its attention to local resource mobilization to be used for any bad days ahead. And so far, $6 million in cash and millions of dollars of support in kind have been collected from the public.
This pandemic is not only a problem of health, it's a problem of the economy, it's a problem of the social affairs, and overall, it's an issue of national existence. Therefore, based on our poverty level and existing situation, we have to prepare quickly. We have to minimize the effects of the virus on our economy. Secondly, as per our call, what the public is doing is to support each other, which is remarkable. We have laid a working scheme to raise funds and support in kind.
The government has said it will soon deliver its promises of injecting $456 million to the economy through private banks. There's more. Its task force with a mandate of resource hunting has been successful.
At the level of the federal government, we have a task force with the mandate of locating and securing establishments for the use of corona-related needs. In the capital, Addis Ababa, for instance, close to 200 places are prepared for holding and even for providing medical services. In total, close to 200,000 people can be served there in the future.
But the government also is planning ahead.
We have an emergency food accumulation program to be used for times of drought and at times of any natural disaster. We have this scheme within the country and abroad. We now believe we have to increase our capacity in this area even further. And in case we have to use this plan to provide for our people during this corona pandemic, then first we have to make sure we reach the higher level. We are working on this seriously.
The coronavirus pandemic is expected to adversely affect many economies, especially those in Africa. The good news is most countries of the continent already are aware and are trying to do something about it, at least to minimize the effect. Economic experts say Africa needs an international support to respond to the COVID-19 pandemic.
We'll take a break, and when we come back, it's the time for international stories. Please stay with us.
When we return, international news. U.S. facing hardest COVID-19 week as it faces mounting death toll. And later, sport. Premier League 2019-2020 season suspended indefinitely.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. In international stories, U.S. senior health officials are warning Americans against what they say would be the hardest week of the coronavirus crisis. They say the death toll could be in unprecedented numbers this next 2 weeks. Some hope was raised on Sunday in a slightly slowing number of fatalities in New York. President Donald Trump echoed some optimism during an evening briefing, but he still acknowledged that difficult situations are ahead. Director of the U.S. National Institute of Virology and Infectious Diseases, Dr. Anthony Fauci said in light of the optimism being expressed, quote, tomorrow, the next day are going to look really bad, end quote. Confirmed coronavirus cases in the country have reached nearly 340,000 with just under 10,000 deaths. British Prime Minister Boris Johnson's COVID-19 symptoms have sent him to the hospital where he is undergoing tests. It has been 10 days since he tested positive for the virus. The Prime Minister was in self-isolation in Downing Street since last month. He went to the hospital on Sunday because he still had high temperature. His doctor said he needed additional tests. Johnson is said to still be in charge of the government. His office and ministers say he's doing well and that his additional hospital tests were a precaution. The nature of the test was not explained. Housing Secretary Robert Jarrick said the Prime Minister will stay in hospital as long as necessary. He said this was not an emergency admission and that he expects Johnson will be back at Downing Street soon. The latest figures show there are nearly 42,000 confirmed cases of coronavirus in the UK, with a current death toll of 4,300. China observed a national day of mourning on Sunday to remember those who lost their lives to COVID-19. The moment fell on Tomb Sweeping Day, a traditional festival when Chinese people remember their deceased. Sirens blared for those who died of COVID-19 and national flags were lowered to half-mast. Reporter Liu Yong has the details.
It's China's annual day for remembering deceased loved ones. Ding Yong and his sister arrived early to pay respects to their father at Babaoshan People's Cemetery just west of Beijing. This year, to prevent big groups from congregating, the local government requires an appointment in advance. Each of appointment allows no more than 3 people to visit. As per Chinese tradition, they rinse the tombstone and present a bouquet of chrysanthemums to their late father, representing their cherished memories.
In the past, the whole family came together. This year, we arrived in stages to commemorate our loved ones.
In Beijing, memorial services started on the 21st of March and lasted for 23 days. Besides booking the date and the times of visits via cell phone app, one can also make an appointment via telephone and on-site.
We launched the appointment service this year. If people decide not to come on-site, our staff can pay respect to their loved ones for them. This year's booking is time-sharing. It is good to disperse the flow of people.
This year, Babaoshan Cemetery only allows a maximum of 3,300 people to enter the site per day. By April 3rd, over 400,000 people had booked the memorial services in Beijing.
This reduces the chances of the virus spreading and is good for us. We also can pay respects to our deceased relatives. The cemetery is also less crowded.
One employee says last year's Qingming Festival didn't require appointments, and visitor totals were around 20,000 people per day, 50,000 on peak days. China's Ministry of Civil Affairs suggested that local governments suspend group tomb sweeping day activities such as collective public offerings and non-profit burial ceremonies in accordance with their own local COVID-19 control situation. The main purpose is to prevent mass gatherings and reduce cross-infection.
A team of volunteers in the Gaza Strip has translated a Chinese booklet about the country's clinical experience in fighting the coronavirus. It's an initiative to help Arab speakers understand the Chinese experience in a simple and accessible way.
On March 18, the Jack Ma Foundation and Alibaba Foundation announced the publication of a handbook detailing the best practices for training COVID-19 patients. It was written with the support of a first-of-its-kind hospital, Zhejiang University Medical College. A group of Palestinian academics and translators in the Gaza Strip launched an initiative to translate and issue an Arabic version of the booklet. The team started off with 10 volunteers, but then it quickly expanded to more than 20, including engineers, doctors, nurses, and designers.
Translating and publishing the book on social media and reaching all segments of society is a success to us. Not only will doctors and specialists in this field benefit, but also normal people. We want to raise awareness and change the perception of the general public, as by reading the book they will understand how China has played a role in fighting and restricting this disease.
Iman Abu Shiha is a doctor working at Shifa Hospital in Gaza City. She's one of the most prominent volunteers who contributed to the translation. Shiha says that Zhejiang University contacted her to help with the project in order to spread Chinese culture and share the country's unique experience in dealing with the crisis.
Translating a complete experience in combating this epidemic, and specifically because this experience was at the place of the onset of the disease, will certainly enrich all of our information as doctors and inform us about the experience of how to deal with cases of the disease in the correct manner in the event of a pandemic here in the Gaza Strip.
On the Arab-speaking internet, the translated booklet has achieved a great success. Its Twitter posts have exceeded 15,000 likes, while Arab doctors and healthcare professionals have downloaded thousands of copies of the translated work in just 4 days.
Up next, sport. Premier League 2019-2020 season suspended indefinitely. Please stay with us.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News in Sports. The 2020 Naismith Memorial Basketball Hall of Fame has been unveiled. It is headlined by late Kobe Bryant, Tim Duncan, and Kevin Garnett. The trio of Bryant, Duncan, and Garnett combined to win 11 NBA championships and 4 MVP awards across their decorated careers. Garnett has spent his post-playing career working in media, while Duncan is currently an assistant coach for the only team for which he ever played, the San Antonio Spurs. Kobe Bryant, who died in a helicopter accident in January, has been inducted posthumously. It is certain the Premier League will not resume at the beginning of May, and the 2019-2020 season will only return when it is safe and appropriate. Premier League clubs are also in pandemic. That is in the news this evening. Thank you for joining us. For details on these and other stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.